I'm Derek Barron. I'm the Director of Care at Erskine, the Veterans Charity. I've been in care for 6 years, social care for 6 years, and then before that I was in the NHS for 32 years. When I left, I was the lead nurse in a health and social care partnership, so social care has always been part of what I've done, and I was an Associate Nurse Director for mental health services. I have always been interested in working with older adults. I started my career there and I've dipped in and out of various bits, so it seemed to be a natural progression as my NHS career I felt was coming to an end, that I wanted something that was sustaining, something that was interesting, something that had always been a part of the passion that I've felt throughout my career. So moving back to look after older adults was fairly natural, I felt. I think there's a number of events that you can see. So we did a project with Luminate, Scotland's older arts organisation, and when we were working with, they were working with the residents, and you see the joy, the interest in the residents' eyes when you see what they produce. At Erskine we also have a bike meet, a motorbike meet. When we've got between 800 and 1,000 motorbikes in our grounds just on the Sunday, and the residents get involved in that. There's a joy, there's a light goes on in their eyes, in their face. That is the kind of thing that goes, wow, that's what we're about. We're about making people's lives the very best they can be. And in other places, these are old people, they go away into home and nothing happens. Far from that, it's a part of the community, it's a joyous thing that we should be having. And yeah, that sustains you as a nurse through difficult times when you see the joy you bring. Clearly, money's a challenge. However, there's more than just money to think about. There's how the sector's understood, and I think it's badly understood by politicians, by the media, by the public. They don't understand the importance of what we do, they don't understand how we do, and they don't understand the interrelation that the NHS has with social care. The NHS cannot function without social care, but there's an apparent lack of understanding of that. And so it's easy to have a prod or a kick at a care home who's not done things well, but there are hospitals that don't do things well. Instead of going, what's the great things that the sector does? How would the NHS manage without the social care sector? How would it manage without care homes? And it frankly wouldn't. If you take away care homes, then actually the NHS grinds to a halt. There's nowhere for people to move through. And we all hear that horrible expression about delayed discharges or delayed transfers of care. That's just going to go through the roof without the social care sector here to pick up and support people out of hospital, because hospitals are not good places for older adults. They're not conducive for their good mental health or their physical health, because there are places where the infections abound and people go and they're ill. So it's about bringing people back. So they're interrelated, and we really need people to understand that interrelation and treat them equally. Because without that, we're heading for a disaster. And we're already far down the road of finding things difficult. I think it's going to be a lot worse unless we get that understanding.